This video is about our Healthy Gum Advanced package. This is for patients that have had a history of more advanced dental cleanings like deep cleanings or scaling and root planings. You have reason to believe that you have or have had some history of gum disease. This would correlate with a dental patient who had 4 to 6 millimeter pockets around several teeth, a mild to moderate history of decay, a significant amount of dental work either as a child or adult, and or a family history of periodontal disease. This package includes a product called PerioScript. I recommend PerioScript when trying to effectively clean deeper gum spaces or pockets with patients who have 4 to 6 millimeter pockets. An oral irrigator is required. Deep spaces in the gum and bone around teeth harbor deadly and disease-causing anaerobic bacteria. There's growing evidence that most heart disease originates in the mouth. When we develop pockets around our teeth from bone loss, brushing and flossing is ineffective in cleaning to the base of the pocket where the infection and further tissue destruction is actually occurring. An oral irrigator is a home dental care device. Oral irrigators work by using a stream of pulsating pressured liquid to dislodge biofilm plaque from gaps between the teeth, around gum margins, and from deeper gum pockets. A commonly known brand is Waterpik. We have seen that using an oral irrigator can greatly improve the oral health of a patient and many times can make the difference between saving and losing teeth. PerioScript is an all-natural, concentrated solution that we recommend for use in an oral irrigator. This proprietary vegetarian formula of soothing organic and responsibly wildcrafted herbs plus essential oils supports oral health. PerioScript is enhanced, a holistically balanced patented herbal extract shown in independent laboratory studies to promote cell vitality. This advanced formula naturally flushes around teeth and hard to reach areas, leaving your mouth feeling clean and fresh for hours. If you have any history of bone loss or pocketing, using PerioScript regularly can help maintain healthy gums. It's also safe to use with cosmetic restorations. The bacteria and biofilms in our mouths become more dangerous and aggressive as our gum disease worsens. So with the Healthy Gum Advanced package, we offer multiple essential oil strategies for naturally controlling infectious microbiology. Bad bugs in the mouth can't form strategies for outsmarting essential oils the way they have with antibiotics. The natural phenols in oils have helped to control oral infection for thousands of years, and the bugs have never learned a way to adapt. The key becomes finding the right combination of the right essential oils with the right properties to kill bad bugs while also supporting improved soft tissue health. Is it really important to use organic oils in the mouth? We know that plants grown organically don't contain pesticides or GMOs, and the research has already resoundingly shown that organically grown plants are nutritionally superior to plants that are grown with conventional farming methods. In particular, organic plants have 20 to 40% more antioxidants than plants grown commercially. It is for this reason that we only recommend pure organic essential oils at Transcendental Health. With the Healthy Gum Advanced protocol, we also incorporate additional essential oils to help naturally reestablish a healthy bacterial flora in your mouth. Our recommendation is that once a day or in the mornings you use Aura MD liquid toothpaste and that you use one of the following high-quality essential oils in the evening. The other essential oils I advocate in my practice are for a company called Aura Wellness. And the product is called Heal Thy Mouth Blend. We carry two different ones, one that has a nut-based carrier and one that doesn't. I really like this oil because of the quality of its ingredients and the thought that went into its manufacture. Since this product is used in the mouth, and the mouth is the main pathway for introducing new stuff into the rest of the body, they knew the formula had to be a balance of warming and cooling oils. That way, we wouldn't be causing any imbalances downstream from the mouth. For example, I've heard of people who had progressively damaged their health over many years by repeatedly using the same products that contained only cooling or mint family ingredients. The habitual cooling of one's stomach fire can cause all sorts of digestive problems down the road. On the flip side, using only warming ingredients like cinnamon or clove can overheat the digestive system. I like this product's thoughtful approach to balance for that reason. I feel like it's a therapeutic systemic oil as well as a great oil for gum health. Scientific literature shows that both peppermint and spearmint are very effective in reducing certain oral pathogens, particularly those related to gum disease. Cinnamon contributes to the warming profile of the formula. Also, the literature suggests that cinnamon essential oil is the most effective in stopping strep mutans, the main bad bug implicated with tooth decay. Clove has long been used in traditional medicines around the world to alleviate oral health issues. Research shows that clove helps balance the oral microbiome by lowering the presence of the bad bugs associated with gum disease. This ability oral bacteria use to communicate across species is called quorum sensing. Clove has been shown to be effective in disrupting quorum sensing. It's like scrambling the communications of the bacteria, which supports your preference for a healthier mouth. Another benefit of the clove is that it contains a compound called eugenol. Eugenol is another great oil because it helps to soothe any distressed or painful nerves. In a chronic bacterial infection like gum disease, nerves are frequently damaged and become inflamed. Clove helps to soothe painful nerves. Myrrh has been used since before biblical times to help heal a wide array of health issues. Treating everything from hay fever to herpes, myrrh has lots of useful functions due to the positive impact it makes on oral tissue healing. Myrrh speeds the healing process by increasing blood flow to the compromised tissue. Myrrh also helps to balance the oral flora. Most people associate the word manuka with the honey produced from the same plant. Manuka honey is honey produced by bees that have gathered pollen from the manuka plant. Oral Wellness Heal Thy Mouth blend does not contain any honey or bee products, but it does contain the essential oil derived from the manuka plant. Scientific literature has shown us conclusively that manuka oil showed significant adhesion-inhibiting activity against Porphyromonas gingivalis. In other words, manuka makes it more difficult for bad bugs and the plaque that they create to cling or adhere to teeth and gums. The adhesion inhibition produced by manuka oil is a very positive step towards a healthy mouth. The long-term maturation of plaque results in more and more damaging and sophisticated biofilms. Manuka also happens to be the most effective plant essence for managing the toughest of bad bugs associated with gum disease. The original Heal Thy Mouth blend has always been made with certified organic sweet almond oil. Almond oil is a super mellow oil that has beneficial qualities of its own. Sweet almond oil was chosen because of its very, very light color, and the flavor helps harmonize the other oil flavors in the formula. Customers with nut allergies can use a nut-free version. It contains certified organic jojoba oil as the carrier oil for the nut-free Heal Thy Mouth blend. Next, I'd like to talk about the oral probiotic that we advocate in our practice. Although we carry several in the practice that we use with different clinical situations, in general, I think the best oral probiotic we have is one called ProBioPro. You have to remember that your mouth is the gatekeeper and the first line of defense when it comes to the microbes that make their way into our bodies. You might be familiar with your gut microbiome, but did you know that different probiotic strains populate the oral cavity also? And if the balance of good bacteria in your mouth is compromised, dental issues can develop. Even more, poor oral health is often indicative of problems elsewhere in the body. We want to help you keep this often forgotten microbiome in optimal shape. Did you know that when you use mouthwash to prevent bad breath, you kill both the good and bad bacteria? And did you know that it's up to the good bacteria to keep the bad breath-causing bacteria in check? In fact, Strep salivarius is often found in healthy mouths, yet is deficient in those who suffer from bad breath. The probiotic Strep salivarius M18 produces an enzyme that helps to dissolve and loosen the formation of biofilm and sticky deposits that can eventually lead to problems. The strains M18 and K12 crowd out undesirable bacteria, offering a proactive solution by addressing the root cause of unhealthy gums. The strains in ProDental Pro are among the most important and beneficial bacteria of the mouth. In fact, research shows that K12 can activate your immune system within just 24 hours. This means that the best long-term solution to eradicating bad breath and oral health problems is to repopulate your oral cavity with the good guys found in a great oral probiotic. Typically, we try to mask bad breath with cosmetic products such as mouth rinses, sprays, and different types of gums or mints. When K12 colonizes in your mouth, it actually crowds out the odor-causing bacteria and therefore targets bad breath at its root. This probiotic has also been shown to help maintain healthy ears, nose, throat, and sinuses. When your oral microbiome is populated with strong probiotic colonies, you are equipped with natural defenses against common invaders. ProDental Pro is formulated with targeted probiotic strains to restore the balance of good bacteria and promote oral and upper respiratory health. For naturally boosting your immune system, we use a product from Quicksilver Scientific. It's a liposomal vitamin C. I advocate a particular type of vitamin C for my patients who are trying to accelerate and improve their healing. I recommend it for my mercury and root canal patients to build up their immune systems prior to their procedures, and I recommend it for gum tissue and periodontal health because the mouth is like a wound that is constantly healing. There are gobs of literature demonstrating vitamin C's positive impact on gum health and soft tissue and wound healing. Although this protocol only advocates using vitamin C for a month, it is good to take throughout your entire life to support a healthy immune function and resistance to disease. I therefore recommend that this supplement be taken on and off regularly for the rest of your life. Personally, I always increase my intake of vitamin C before I fly or travel, or in times when I'm under arrested or feel fatigued. I partner with Quicksilver Scientific and Quicksilver's delivery systems for many reasons related to the improved quality and benefit of using their products. Their liposomal vitamin C essentially brings the power of intravenous or IV infusion therapy into a very convenient and tolerable vehicle for delivery. Quicksilver has improved on liposomal and emulsification technology with smaller, more stable particles made from the highest grade ingredients available. In addition to exceptional absorption rates, these very small liposomal and nano-emulsified particles enhance lymphatic circulation and nutrients and intracellular delivery. I believe that traditional vitamin C tablets or capsules are at best absorbed about 50%. This means that only 50% of the dose you took will actually be received by your body for benefit. With Quicksilver's vitamin C, over 90% of the dose taken is absorbed, so you can basically use less for a greater therapeutic benefit. In addition, the phospholipids inherent in the liposomal and nanoemulsified formats nourish cell membranes, promoting proper function for the absorption of nutrients and the excretion of cellular waste products and toxins. Liposomal vitamin C with R-lipoic acid is an awesome immune builder. Beyond its well-known role in supporting normal immune function, vitamin C supports the growth and repair of collagen in all parts of the body, including the mouth. Cholesterol metabolism is a cofactor in numerous enzymatic reactions and is necessary for the synthesis of hormones and neurotransmitters. As an antioxidant, vitamin C scavenges and neutralizes free radicals and supports levels of vitamin E and glutathione. Delivered with vitamin C, the antioxidant R-lipoic acid supports endogenous production of glutathione, an integral component of detoxification. Lipoic acid also supports mitochondrial function and is able to pass through the blood-brain barrier. and as such may be neuroprotective. Buffered forms of vitamin C, such like this, are generally higher and better tolerated than regular ascorbic acid supplements by those with gastrointestinal sensitivity, which enables higher vitamin C dosing benefit without GI side effects. The absorption of conventional oral vitamin C diminishes rapidly as the dose increases due to gastrointestinal saturation. The liposomal format optimizes delivery of both these important antioxidants. For suggested usage, I recommend adults take 2 pumps by mouth twice daily, holding in the mouth 30 seconds before swallowing. I sometimes have patients take 2 pumps 3 or 4 times a day depending on their situation. It is recommended to be taken on an empty stomach at least 10 minutes before meals. It may also be stirred into a small amount of water. This liposomal C can also be used topically, where one could apply a thin layer to clean skin, avoiding the eyes, and to leave it on for 10 or 15 minutes. It is recommended to keep refrigerated and to use within 30 days of opening. Next is Common Sense. Common Sense is a sodium bicarbonate or baking soda-based powder for alkalizing the mouth and lessening bacterial growth and activity. Dr. Tim Rainey, the product's inventor, found a way to remove a lot of the abrasiveness of baking soda without losing its alkalizing properties. Alkalizing the oral cavity is critical for supporting dental remineralization, and Common Sense consistently raises the pH of the oral cavity. It contains xylitol, which has been shown in research to reduce Streptococcus mutans, the bacteria associated with tooth decay. It also contains bioavailable minerals for teeth like calcium and phosphate. Stevia and mint leaf oil help to give it a great taste. This product is a must for anyone wanting to stop decay and/or promote remineralization of tooth structure. I believe it is the exact right adjunct to the Aura MD oil and should be used every time one brushes their teeth. The oils in Aura MD help control bacteria and improve gum health, while the alkalinity of the Common Sense helps to provide a healthy environment for the teeth. These two products are a very thoughtful and very effective combination. Next, we include pH paper for monitoring salivary pH in association with certain foods, drinks, and dental products. This can be very helpful when trying to understand how your lifestyle is affecting the pH of your mouth. The pH paper can also be used for urinary salivary journaling for systemic monitoring and diagnosis. Our website includes information and forms for helping to evaluate salivary and urinary acid-base balances and their systemic implications. Next is a Bass toothbrush. We include a Bass toothbrush because of the increased effectiveness it has demonstrated in research for removing dental plaque. It has the most effective bristle design for plaque removal. We recommend brushing your teeth with a Bass brush twice a day or after meals if remineralizing or currently undergoing treatment for gum disease. Finally, in your basic package, we include floss. We recommend daily flossing. Although many products claim to replace the need for floss, I still think it's critical for breaking up plaque deposits and biofilms in the gum tissue between the teeth and cleaning the space where the teeth contact each other. I recommend flossing daily, but must be accomplished every 2 days, as it actually takes approximately 48 hours for plaque left behind and between our teeth to actually begin to cause tissue inflammation and eventual bleeding. We like Radius Natural Silk Floss because I think it's the healthiest floss you can use against your oral tissues, and we're including a box of it in your Healthy Gum Basic Hygiene Kit.